Last fall, a young mother came into the free healthcare clinic right here in Provo while I was volunteering. Among many things, this woman complained of pain so severe that she struggled to live her daily life comfortably. This woman, after running some tests, the physicians found that this woman's thyroid was not functioning properly and that she would need surgery as soon as possible. However, this woman was uninsured, and while the free healthcare clinic serves uninsured patients, they had already used their one free surgery that they offer a year. The doctors told this woman that they would advocate for her, but that she'd likely end up having to pay $18,000 out of pocket or live in pain. For the last 5 years, I've worked closely alongside physicians, and I have seen both the complexities and the difficulties of our modern healthcare system. I have seen firsthand how legislature and efforts to reform the medical system have failed to address skyrocketing healthcare costs and have failed to address that malpractice lawsuits are a large contributor to these skyrocketing healthcare costs. Malpractice lawsuits are undermining our modern healthcare system, not only by increasing healthcare costs, but also by eroding the patient-doctor relationship. Both physicians and patients need better protection from these lawsuits. In a study run by the American Medical Association in 2016, they found that 49.2% of physicians over the age of 55 have been sued at least once in their career time. While many of these lawsuits are baseless, in fact, 70% of them are thrown out almost immediately, doctors still spend $30,000 protecting themselves from these baseless lawsuits. In addition, the Medical Liability Monitor found that physicians are paying steep prices on medical malpractice insurance premiums to protect themselves from lawsuit. The average OBGYN physician spends anywhere from $50,000 to $214,000 a year on medical malpractice insurance. The cost of lawsuits do not end there, though. In a Jackson Healthcare Group study, they found that 92% of physicians practice defensive medicine. Defensive medicine is when a doctor prescribes a treatment or runs a test, not because the patient necessarily needs it, but so that in case they're sued, they can show that they did everything possible. This might not sound like such a bad thing. Cautious medicine can be good. However, we must consider that defensive medicine costs the United States anywhere from $650 to $850 billion a year, making up 1/3 of our total healthcare costs for that year. Now, I'm not saying all lawsuits are bad or that they should all be thrown out. We have all heard of Dr. Death, but I am saying that this system needs reform. By introducing specialized medical courts, doctors and lawyers could work together to throw out frivolous lawsuits. And by placing economic caps on non-economic malpractice lawsuits, we could live in a better world. We could live in a world where young mothers can afford the surgeries that they need. We could live in a world where healthcare could cost as much as 1/3 less. In 2019, my sister was diagnosed with multiple sclerosis. As a part of her intensive treatment, she had to undergo chemotherapy, and her doctor warned her that this chemotherapy may cause her to become infertile and that she should store her eggs just in case. However, he followed up on this by saying that she didn't have time to store her eggs and it doesn't make sense for her to, so she probably shouldn't. My sister left this conversation both feeling very confused and a little bit more wary of her doctor's judgment. When doctors are under constant fear of litigation, this decreases the quality of care that they offer each patient, and it increases the mistrust that patients feel towards their doctors. In an NIH study, they found that the average patient rated their distrust for their doctor as a 6 on a scale out of 10. My sister later followed up with her physician and asked what advice he would give his very own daughter if she were in her shoes. He explained he would tell her daughter not to worry about it because the chance of becoming infertile was so low, but he had to tell her this for liability reasons. It's clear that our current medical system is suffering under the weight of frivolous lawsuits, skyrocketing healthcare costs, and eroded patient-doctor relationships. We not only have the ability, but we have the responsibility to advocate for change that will protect our physicians, lower healthcare costs, and increase the quality of care that every patient deserves. Imagine living in a world where doctors can focus on healing rather than defending themselves in court. Imagine where young mothers can afford the surgeries they need. Our current system is harming both patients and doctors. We need change. Perhaps we start by asking malpractice lawyers to take the Hippocratic oath to do no harm.